From the time they cut that first baby tooth to the thought of braces. There's so much we need to think about as moms when it comes to our kids' dental health. Hey mamas, I'm Marissa. NJMOM is teaming up with Shore Children's Dental Care to give you a breakdown of things to think about at each age and explain why pediatric dentistry is different.
We treat infants, children, teens, and special needs children. So I'll see you in about a month, okay? We do things in our offices that are different than you might see in a general practice. Our approaches, the designs of our office, how we treat children, for the same reasons that a parent might choose a pediatrician for their child's medical care, that's the same reasoning that we tell parents that they should be choosing a dentist for their child's dental care. The office should be welcoming. It should be warm. Video games for the children.
Who's winning?
Other things for them to read and to be entertained.
It's a very welcoming environment, and so I think that takes away some of the anxiety as well. And the one thing that I like the most is before Vienna's first visit, they gave us a book about going to the dentist. So we could read about going to the dentist and the different children's experiences. So it kind of took the fear away from going to the dentist.
Let me see the smile.
You didn't really know the difference between a pediatric dentist.
You would think it was the same thing, from an adult dentist to a pediatric, but it's really not. They just specialize in every little thing a child could have wrong.
You look good.
But an adult dentist doesn't really deal with on a daily basis.
I ended up here because she had a lip tie and a tongue tie when she was younger, and I was nursing.
We're seeing many mothers who are referred to our office who have newborn infants who are having trouble nursing. Look at you. And we can do procedures to make it easier for the mother and the baby to have a proper latch.
So Dr. Sherman is here sort of schooling us on some of the things that we as moms need to look out for along the way. What advice do you have for moms?
So the first time that a parent should be bringing their children to the dentist is by 1 year of age.
1 year, moms.
1 year.
1 year.
1 year, okay? The earlier we see them, we can talk to parents about potential problems. The more we can diagnose problems and take care of them. Can you see this? It's very tight. Obviously, to see that they have no cavities. If they do have cavities, then we take care of them. Any gum problems, issues with a child's bite or occlusion as it's called, and prevention really is the issue here. The health of the adult teeth is many times determined by the health of the baby teeth.
So then moving out of the sort of toddler phase and into sort of the elementary age.
The most common things that we're seeing at that age period are cavities. Open real big for me, right? Good. Okay. He's good, no cavities. A cavity is not just a hole in your tooth. A cavity is an infection.
Of course, we've had our cavities. We still do.
Brush and floss. And when you leave this in a child's mouth, it sets up an environment for them to have more cavities.
As moms move into those preteen, teenage years, what do we need to be keeping in mind in terms of orthodontics?
And there are things that we can do preventively, as I explained to you before. Her braces were finished and everything came out great. They may have a very narrow top jaw where we'll use what's called a palate expander, and to make sure that their growth and development is moving along until they do need braces.
There's a lot going on in the mouth.
The earlier that we see children, the fewer problems they have.
Are these her first x-rays?
Those were her first x-rays. I'm not really sure.
She did well.
I'm not really sure if they even got them.
Distraction is a very, very good behavior management technique in a pediatric dental office. The children in this office have TVs that they watch. In addition to that, you have to have the right staff. If you have the right staff and the people that will calm the children,
All right, let's find you some good stuff.
I think it makes an easier visit for the children.
They're amazing. They are friendly. They are accommodating. They make you feel welcome.
And we had such a great first experience that we just came back.